Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 20 of the Ask Dr. Angela podcast. Do you ever ask just really dumb questions? I was seeing patients the other day, and I say the other day, it's like I see patients every day, but I was in an exam room with a patient, and we always have like a ton of laughs in the exam room, but I said to her, "How are you doing?" And then I looked at her and I said, "Isn't that like a dumb question? What do I mean, how are you doing? I mean, you are in an OBGYN's office, for crying out loud. Who really wants to be here or who really wants to be there, right? I mean, the fact of the matter is, most women do not like to come and see me. I rank right up there with the dentist with regards to doctor's visits that folks hate the most. But I'm going to go out on a limb and tell you that I personally will take a visit to my friendly OBGYN any day over seeing the dentist. I absolutely hate the dentist. I mean, if I could prescribe myself some Xanax or some Valium prior to even something as simple as a teeth cleaning, I probably would. My dentist friends and I always have, it's a running joke between us. We've got an ongoing bet, about who patients prefer to see. And surprisingly enough, it really is about 50-50. Half of my patients say that they will prefer to see the dentist. The other half say that they would prefer to see the OBGYN. But again, for me, hands down, it's the OBGYN. The other thing that I notice about seeing patients in the office, and I'm not sure what you guys use when you go to your OBGYN's office, but we have, these really nice cloth gowns and then these drapes that look like oversized picnic table covers. And most of the time, patients are clueless as to what to do with these. They're just like a big old square that most folks just kind of have sitting there, and they're just oblivious as to what to do with them. And so I have patients that make skirts out of them, use them as sarongs. I've even had a few folks, honestly, make origami with them. So it just kind of cracks me up. But anyway, let's jump right into today's question, which is coming to us from Jackson, New Jersey. Jersey has been in the house, so I'm excited about that. Miss Debbie, what do you have for us today?
Hello, Dr. Angela. My name is Debbie from Jackson, New Jersey. My question is about proper hydration. Do pregnant women require more water to stay hydrated than everyone else? And does dehydration affect a pregnant mother and her fetus more than anyone else? Thank you. Rock on.
Thank you, Miss Debbie, for asking this question. I was beginning to think that I only did GYN. I love questions about pregnancy because, again, that is the other half of what I do. So as a complete aside, please bring the pregnancy questions. I'm more than happy as well as equipped to address them. So in addressing your question, Miss Debbie, hydration in pregnancy is super paramount. And the operative word here is pregnancy. Remember, when you are pregnant, it no longer is about you, but it's all about the baby. So one of the things that I oftentimes talk to my pregnant moms about at every visit is, are you hydrating? Are you drinking enough water? Most of the time the responses are, we're trying, I'm doing the best that I can. And sometimes it's just a flat out no, because I totally get it. I didn't drink enough water in my pregnancy because the fact of the matter is, number one, you've already got a baby that's dancing and tiptoeing on your bladder. But the more you drink, the more you have to go to the bathroom. And quite frankly, who really is excited about having to go to the bathroom all the time? So again, I totally get it. But the benefits of staying hydrated in pregnancy are numerous. They range from things like helping to decrease swelling or edema, which seems a bit counterintuitive, Also helping to decrease stretch marks. That's a biggie. I mean, people, think of it this way. Soft, stretchy, and hydrated stretches so much better than dry, brittle, and cracked. Get what I'm saying? The other really big thing is that helping to flush your system will rid your body of all of those toxins, infections, decreasing the risk of things like urinary tract infections. Staying hydrated helps to keep your skin clear, clean, soft, supple, because we all know what the hormones of pregnancy can do to our complexions. Yikes. I was one of those that was personally affected, and I had terrible skin during my pregnancy. So I was pushing water whenever I could remember to do so. Drinking plenty of water is going to help with staving off things like constipation. Again, the hormones of pregnancy slow everything down, and your bowels are a huge piece of that. So staying hydrated helps with that. And the other thing that I always tell my pregnant moms is when you are dry, uterus becomes very unhappy. Being dry, again, can lead to constipation, but it can also lead to preterm or premature uterine contractions. So you want to hydrate, and hydrate. So, Miss Debbie, I guess in a nutshell, hydration is really super important. And I'm going to even say more so in pregnancy because, again, during the pregnancy, it's not just about you. It's about baby and making sure that we provide as good an environment for baby to thrive in, and certainly staying hydrated helps to create such an environment. The other just kind of pearl that I oftentimes give my pregnant moms is, whenever I walk into that exam room and I ask about that hydration status, I go over and take a peek at your urine. Your urine is a really good indicator of your hydration status. If your urine is dark, looking like Arizona tea, you need to drink more water. Your urine needs to be clear, light yellow. That's good hydration. So, Miss Debbie, I hope this has helped to answer your question. I would like to thank you so much, not only for taking time out of your busy schedule to submit this question, but thank you, golly, for submitting an OB question. I've been dying for some OB questions, so people, if you're out there listening, submit some OB questions. I take care of pregnant women all day, every day. Miss Debbie, someone from my team is going to be reaching out to you so that we can get your contact information. And because we did feature your question on the Ask Dr. Angela podcast, we will be sending you one of our bomb-ass t-shirts. For those of you who would like to have a question featured on the Ask Dr. Angela podcast, please go to www.askdrangela, that's AskDrangela.com. Click on the microphone, which is on the right side of the page, and do what you do. In closing, I'd like to leave you with this. Sonia Friedman once said, "The way you treat yourself sets the standard for others." Until next time, look better, feel better, be better. Can't wait to reconnect on episode 21.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.